First is the best is the breast milk. The babies are real fighters.
So what exactly is that mother's touch and how does that heal everything?
The mother is the first doctor actually, then we come the last, I think.
Do you think it's safe to have pets at home with newborn? So welcome to the program, doctor, and it's a pleasure to have you.
Thank you.
So the world of neonatology, where life begins small but the miracles are big. So what made you choose this specialization and how is it different from the regular pediatrics?
Actually, when I was doing my MBBS, actually I have passed from Odisha, Bhubaneswar. So when I was into the intensive days and I was doing my duty in the pediatrics, it worked for me and I thought I will be pediatrician first. Then I joined pediatrics, MD pediatrics, and that actually attracted more actually. Then I did my senior residency at AIMS, and in that phase I have worked in NICUs, and that time I saw the tiny babies, they are struggling for their lives, and again that drove me hard, and that time only I chose to become a neonatologist. And
So no doubt, the moment the baby is born, it's such a precious moment for the entire family, isn't it? So what are some general concerns or general anxious things that every parent would be going through, what they should be knowing?
Yes, actually, the thing is, first is the prematurity. The prematurity term is a huge actually. Generally, at 6 months pregnancy, like it is around 24 to 45 weeks, when the babies will get born. That time they are very tiny. All the organs are matured. The organs and lungs, brain, intestine. So they are not stomach. So they can't. They are completely matured. So that time we have to give that sort of like in utero, what the baby should behave inside the uterus. We have to give that atmosphere outside the outsides. So that is the main thing actually. And the parents generally we see for the breathing difficulty problems, feed indigestion issues. Those are most problem, and the main problem is the bleeding inside the brain. And again the heart issues also. They will having some fast breathing, difficulty in breathing, and again the saturations like the oxygen levels are not being maintained. Those are the reasons we generally look for the babies.
So talking about another important aspect, what you've mentioned is the feeding. So the breast milk or the breastfeeding is the best thing for any baby, they say. So what are some common concerns around feeding?
First is the best is the breast milk. So again, what I mentioned earlier, that low birth weight, very low birth weight actually. When the very low birth weight is coming, that means the weight is less than 1.5 kg. Generally, we have to with the breast milk only. If the babies are born term, then that time we have to give mother's milk only if the babies are well. Breast milk along with the formula feeds if the mother is still on the OT table and she can't give, we can give 1 to 2 feeds of formula feeds. But in the preterm babies, the problem is we have to give them a donor mother's milk. We have a lot of milk banks over here. Formula feeds we generally don't recommend. If we are giving the formula feed, there is a chance of there is a feed indigestion issues in the preterm babies. But term babies are well, the intestines are enough matured to digest the formula milk. So best is the mother's milk. Again, it will be greater than the donor's milk, more than the formula milk. Like we have to give the breast milk as soon as possible.
So another common concern is, about what we talk about kangaroo touch. So what exactly is that mother's touch and how does that heal everything?
Kangaroo mother's care, again, mother's care is a misnomer. Any grandparents, father also can give that care. So the kangaroo mother care is the best for the healable babies. Again, that is the very low birth weight babies. Any babies born less than 34 weeks, any babies, the weight is less than 1.5 kg. We generally recommend kangaroo mother care if the baby is hemodynamically stable. The mother will keep the baby skin to skin. They will give the skin to skin method. In that method, the bonding will be improved. In that method, the feeding will be improved. The technique will be improved, and the bonding. Again, the studies have shown that it will decrease the hypothermia. Hypothermia means the cold, like the cold, the warmth will be perceived by the baby. The bonding will be improved. There will less chance of infection in the babies in this kangaroo mother care. And again, the mortality is reduced. The baby mortality is reduced by this kangaroo mother care. So this is the best thing what we can do in a peripheral level, in the community level also we can do these things. The kangaroo mother care doesn't require any sort of tertiary care hospital. You can give in home also.
So, talking about NICU, doctor, when do you think a baby would be requiring an ICU, and what are the latest developments or techniques that are there or available today?
The thing is, again, what I've mentioned earlier also, the prematurity. The first is the
That's
prematurity
important.
babies. That's more important. Again, in the term babies having some sepsis also, some infection, and that also most common cause. If any complication in the pregnancy is like, baby has passed stool inside the uterus and the baby has taken the meconium, that is called stool, baby stool inside the lungs or the stomach, that also cause some breathing difficulties. So any sort of prematurity, that is called meconium aspiration syndrome, if the baby is taking the stool inside the lungs, that will cause again the breathing difficulty. Any sort of infection that is causing pneumonia, any sort of infection causing the gastroenteritis, any sort of infection that is causing NEC, that is called necrotizing enterocolitis, that is also causing that also is a candidate for the NICU admissions. Jaundice are usually normal for the babies. If the baby is still having high grade of jaundice that needs some blood to blood, we have to change the blood. That is called exchange transfusion. That is also a candidate for the NICU admissions.
So, I'm sure, a baby staying in NICU would be very overwhelming for the parents. So, what kind of emotional support would they be? I mean, would they be requiring at that time?
The babies are real fighters. I have seen a lot of patients, those are real fighters. They have to be counseled daily, twice daily, in the morning and in the evening actually. We have to tell them regarding the baby's improvement or any deterioration. If any deterioration or any improvement, we have to tell them. And moreover, they have to know what the baby is going through now. If the baby is on antibiotics, if the baby is on any parenteral nutrition, that is any nutrition going through the vein, if the baby throws some other symptoms like abnormal movement, like fits and all, we have to tell them. They are very untreatable. They are very vulnerable for all the infections and all the surrounding problems. In the meantime, again, emotional support. When they are going to the baby, the cradle, so they should hold the baby. The mother should talk with the baby. So hold the baby. At least the baby is stable. She can provide the skin to skin. That is called kangaroo mother care.
So once the baby is totally okay and is ready to go home, what are some precautionary measures you think parents should follow, or they should be aware of some red flag signs?
I tell them, my patients, that the mother is the primary doctor. The mother is the first doctor actually. Then we come the last, I think. First, they have to check whether the baby is taking feeds or not. How the baby is taking feeds.
That's very important.
Yeah. How the suck is good or not. Moreover, if the color is changing with the feeds, or even if the baby is not feeding, the color is dusky and cyanotic, I will say, the bluish coloration. If the baby is having some abnormal movements, any temperature actually, if more than 37.5 degrees centigrade or less than 35.5 degrees centigrade or 36 degrees centigrade less than. So it is called, the fever is also not good for the baby. The hypothermia is also not good for the baby.
And also, doctor, another important aspect for newborn care is preventing infection and hygiene. So what are some tips that you would like to give to the parents out there?
Being Indian, and also we are seeing our culture is very different actually. On the 21st day ceremony, 7th day ceremony, birthday, 6-month ceremony. So actually, I will like to say, please don't invite infection to your house. That means generally we have to ask our, our cousin, sister, brothers, they are coming, the grandparents, and many people actually to come to a festival like atmosphere, because a new baby is born and they are very happy. That's a very good thing, that
a
they
big
are
celebration,
happy.
no doubt.
Because the blessings also needed. In the meantime, without washing your hands, without using any alcohol rubs, and unnecessarily kissing the baby, that will again this COVID era also, the babies are more prone for infection. Don't ever kiss a baby unnecessarily. The baby will land up into the infection. And again, suggest the parents also they should wash their hands before manipulating a baby, before feeding the baby. So the parents must wash their hands, and again they shouldn't invite any of the relatives unnecessarily for any occasion. That will be very helpful for the baby and its growth and not landing up into the infection.
I think that's a very important point what you've made, doctor. Another thing is sleep, which is very important for the growth of the baby. So are there any safe sleep practices that we all should know?
Actually, they used to sleep like opposite to us. What we do actually, we work for 18 hours, then again sleep for 6 hours. They generally wake up for 6 hours and they generally you sleep for 18 hours. Again, the sleep, we have to check them actually, how they are sleeping. Supine position, that means the eyes should look up. That is called supine position. In that position, the chances of blocking the airway is very less. In prone position, the opposite to that, when we will like the stomach, the belly on the floor, on the bed, and if the nose and mouth will be blocked, then there is a chance of again the hypoxia, or baby will again land up into dangerous. So again, a disease called sudden infant death syndrome, SIDS. The studies are showing that the most common cause of SIDS is the prone positioning sleep. So please check the baby is completely sleeping in a proper manner, like head, the eyes should be looking up. And if the baby is having vomiting and all, and that time the sidewise sleeping is the most important thing, I will say.
Another common question we get to hear is about pets. Do you think it's safe to have pets at home with newborn?
Pets are safe, but again, I would say in the newborn, please don't allow any pets, because the furs of the pets will again cause infection in the lung. Maybe that will go into the lungs and will again cause the pneumonia. Again, there is a chance of any dogs or any cats or licking the babies, that will unnecessarily create infection, that is maybe rickettsial infections. So we have to avoid pets. If the pets are there, at least for some time, I would say for 6 months at least, they shouldn't be around the babies.
So you working throughout the day and also in the night, watching these tiny babies go through a lot of things. So I'm sure that would be also overwhelming for you. So how do you unwind at the end of the day?
Yeah, it's very tiring, but yeah, I used to enjoy the things. If the baby survives with my treatment, because I again believe that God heals. Yeah, I treat what the God is actually. The most rewarding feature is if the baby is coming out and going out of the NICU and he's in like in the mother's lap. So that is the most rewarding for me. And one more thing is, for me, the preemies, the micro preemies, the premature babies, when they are going outside, that is also a concern, because I have to follow them up for the next 2 years for the neurodevelopmental outcome. Because in the premature babies, there are a lot of time, they will land up into developmental delays. So we have to go through that.
So given a choice, would you still choose neonatology or something else?
This is my, my dream subject actually. I chose to become a neonatologist, and I am really happy when the babies are going outside of the NICUs and in a good manner. This is and with the parents are smiling. That's you can't actually believe what I feel inside. This is the most rewarding thing in my life.
I can definitely see it in your eyes, doctor. So finally, what message you would like to share with our viewers out there as far as neonatology or the premature baby care or any baby care is concerned?
The one thing I will say, just be confident. Please take a proper antenatal checkups all the time, like the WHO what is recommending. Please go to a obstetrician, tell your all the morbidities, what disease you are having, and be confident if you are having if some preemies or any premature babies being born with you. So at least think that we are here at least to treat the baby, and definitely the babies will be well, and definitely baby will be coming out of the NICU. And don't worry if the baby is born premature. I think the babies here, with the latest technology and advancements we have, and the babies will definitely come out of the NICUs, and again you will be happy parents. Be confident, and please go for proper ANC checkups actually.
So thank you, doctor, for an informative session, and it was wonderful interacting with you.
Yeah, thank you very much.